In March 2020, 6 weeks after the British government's first meeting with scientific advisors on COVID-19, Prime Minister Boris Johnson wasn't too worried about social distancing.
I was at a hospital the other night where I think there were actually a few coronavirus patients, and I shook hands with everybody.
On live TV, he even mused about the strategy of allowing the virus to run free. A month later, Johnson was admitted to intensive care with COVID-19 and almost died.
After a week in which the NHS has saved my life.
A new UK Parliamentary Committee's report criticises his government's lack of urgency in responding to the outbreak and mistakes made by government scientists. It notes how the UK went into a national lockdown a week or more after many other European countries. That despite evidence from China and Italy that the virus was highly infectious. An analysis by Imperial College London has estimated locking down a week earlier could have saved between 16,000 and 36,000 lives. The report says these decisions rank as one of the most important public health failures the United Kingdom has ever experienced.
I don't understand why you don't want to apologise.
Well, there are lessons to learn, but the point is that we took decisions based on the science.
Turns out that they weren't following the science, and the scientific method, such as it was, of developing the advice to politicians was deeply flawed, highly secretive, badly informed from experts in some regards.
Professor Gabriel Scally is a member of an independent group of scientists monitoring the pandemic in Britain. He says the government was more concerned about data than it was about action.
The major scientific advisory group on emergencies didn't have public health physicians on it at all.
The report also criticises huge failings at care homes where more than 40,000 people died in less than 2 months. One success it focuses on is the early procurement of vaccines and support for the development of the AstraZeneca vaccine, a workhorse across the UK. A full independent public inquiry into COVID-19 is set to begin in the spring. Redmond Shannon, Global News, London.